Okay, which of the following conditions is most likely responsible for her abnormal vaginal bleeding? Endometrial hyperplasia, endometrial polyp, endometriosis, leiomyoma, and uterine sarcoma. A 55-year-old postmenopausal woman presents with a complaint of abnormal vaginal bleeding. She denies any pain or discomfort, and her medical history is significant for obesity and hypertension. A biopsy of the endometrium is performed. Which of the following conditions is most responsible for her abnormal vaginal bleeding? Okay, I'm leaning more towards I don't really have a great diagnosis. I just know as a postmenopausal woman who has bleeding, and I struggle with these.
So remember, walk me through what risk factors do they give you? Remember, risk factors.
So no pain, what risk factors?
Yeah.
Like
So,
no pain, she's postmenopausal, she's bleeding,
okay.
and they have a biopsy of the endometrium,
So you're skipping over the medical history. So that's important.
obesity and hypertension.
Yep. So you want to add all this to your patient, right? Postmenopausal, uh,
Oh yeah.
vaginal bleeding, obesity, hypertension, and then they did a
So
biopsy. So now what do
yes,
you
with obesity and hypertension, I'm thinking there's going to be increased estrogen.
good?
And with that, it's going to cause like endometrial cancers or endometrial hyperplasia. And
Good.
so I'm leaning more towards that now. That's a very, yeah, that's very what I'm leaning towards.
Final answer.
Yes, sir.
Does it make sense? So I'm trying to
Wow, that's crazy.
yeah, gotta look at everything, right? Don't skip over even the things that you think is like, oh, I don't really need to worry about that, right? But obesity and hypertension is going to give you the answer to this question. Okay. If you kind of ignore that, then it's going to be very difficult because, of course, all you have now to work with is vaginal bleeding. You know what I'm trying to say?
That's exactly right. Yeah.
Questions, concerns about that? It makes it pretty easy, right?
It makes it easy because again, like I know that fact and I know obesity, I got it right because of that,
Perfect.
but geez. Okay, okay, that's good. That's good.